quickly, this is the trachea right here with the rings.
Oh, it is?
This is the larynx.
One of these, the
The
ovaries.
tube underneath it is the esophagus. All three will be asked.
And then-
I'm not going to ask the thyroid. Thymus is in here. I'm not going to ask the thymus. The trachea obviously goes into the lungs. 3 lobes on this side, 3 lobes on this side. These are anterior, these are posterior. This is the heart here. You can see the right atrium or auricle of the atrium. You can see the left atrium. This is the right ventricle. This is the left ventricle. I'm not going to do the coronary arteries or cardiac veins. This thing right here is the pulmonary trunk, and just underneath it here is the aorta. You can barely see it under there. It's right there, the aorta. Going back from here, this is the diaphragm, sternocostal region next to the sternum, vertebral region way down here next to the vertebrae. This is the liver. It's held onto the diaphragm by the falciform ligament. This is the gallbladder. It's in the right medial lobe, so all of this is right medial lobe. This is right lateral lobe. This is left medial lobe. This is left lateral lobe. If you follow the esophagus down, it goes into the stomach with the greater curvature, the lesser curvature, the fundus, the body, the pylorus. The pylorus of the stomach goes in here to the duodenum of the small intestine. Between the pylorus and the duodenum is this pancreas right here. If you follow the duodenum down, it goes into the jejunum. I'm not going to ask you the jejunum, but I will ask you the ileum at the point that the small intestine goes into the cecum. This little thing sticking out, the cecum of the colon. The ileocecal valve is there. That would make this ascending colon, transverse colon, descending colon. In terms of membranes, this is the falciform ligament. I mentioned the lesser omentum. Holding together the small intestine is the mesentery. This right here is the greater omentum. In terms of the urinary system, this is ruptured through pretty badly, but that's obviously a kidney. This is obviously a ureter. This is a urinary bladder. As I pull the bladder away, this is the urethra. So I'm not going to ask the thyroid, thymus, or adrenal gland. Make sure you look at a cat and you see the female reproductive structures.
Thank you.
You're welcome.